Doc Rogina, we had a conversation. I wanted to bring this to an audience of people who out there are dealing with the GLP-1 noise and not sure how to digest and metabolize all of the information that comes in and how to actually feel good and have the results that they want to have and maximize them using the GLP-1s, which you were very resistant to, and have, as a coach, learned to embrace that along with protein support so that you can actually keep your muscle mass while you're losing your weight. Would you talk a little bit about your top tips for somebody who has chosen to take the journey with the GLP-1s in combination with the coaching and protein foods?
Yeah, absolutely. Whitney, I think you hit the nail on the head with the coaching and nutritional support being one of the main ingredients to the program. Having someone that guides you through the process and having the appropriate nutrition to match what your body's going to need when you're on the GLPs is tantamount. You have to have that. But if I had to give you some top tips, number one, absolutely, you got to be on the right dose. The initial dose that you start on may not be the dose that's going to give you the effects you want. And I found that out rather quickly. I worked with my family practitioner here, and I started on the lowest dose possible because didn't know how my body was going to respond. I couldn't even tell I was taking it, and therefore it had no effect. After the first 2 weeks, I thought, okay, it's time to consider increasing the dose. So I talked to him again. We increased the dose. We doubled the dose. And ultimately, we ended up doubling the dose again. And lo and behold, I got to a point where now I could feel the effects. And when I say now I can feel the effects, I mean literally it makes me feel full almost all the time and with very little food in my stomach. So it gets rid of some of the food noise. It helps me because, I'm addicted to, the typical things that, Italians are addicted to, pasta, chocolate, and pizza and that kind of stuff. But when you're not hungry at all, it's real easy to use these medications to get rid of that food noise. So tip number one, make sure the dose is right. And it may not be where you start. Tip number two, eat slowly. I guarantee if you eat fast, you can overeat or eat too fast where your body fills up past the point where you're comfortable. And if you don't wait for the GLPs to tell you that you're full, you can overeat to the point where you'll feel sick. And a lot of patients and a lot of clients have used the GLPs and they end up with nausea, vomiting, and just total misery and abdominal pains. And that's not a way to go. Remember, the GLPs are just a tool.
Right.
And then, of course, the third thing is, GLPs are great, but they're not great without the nutrition piece. And that's where we started with this.
Mhm.
If you just do the GLPs, you're going to lose weight, almost guaranteed, if you're at an appropriate dose and you're eating slowly. But the problem is, if you just use the GLPs and you don't get adequate nutrition, you're going to lose a large amount of muscle mass. And,
Then it's
over
a
the age of
roller coaster ride.
39, boom, over the age of 39, we all lose muscle mass. I'm
Right.
65. I can't afford to lose muscle mass.
Right.
So I need the adequate nutrition. So the tips are number one, real simple, get on the appropriate dose. And it may not be where you start. Number two, eat slowly. And number three, make sure you have an adequate nutritional program to go along with it.
Thank you, Dr. Rogina. And just as a side note, to give Doc Rogina a little edification, he has been a health coach for over 17 years, an OBGYN practicing in Pennsylvania for how many years?
Well, I practiced over 30 years. So
Over 30 years, and you delivered how many babies?
well, I quit counting at 4,000 about 25
Whoa.
years before I retired, actually. So
Well, I think that gives you plenty of edification that you know what you're speaking of, and you personally are doing these drugs along with the protein, and you were very resistant. So the fact that you've chosen this path, how do you feel?
I actually feel really good. I love the fact that the food noise isn't there anymore. I love the fact that it really has helped me cut some of the cravings. So I don't feel like I need to reach for the garbage I used to reach for to kind of fill in between when I was, frustrated or depressed or excited. I was an emotional eater. The problem was I ate for every emotion.
Right. Anybody who has a comment or would like Dr. Rogina to give you any advice, please comment below. Thank you, Dr. Rogina. We appreciate your advice and your insight.
Not a
Cheers.
problem. Have a great